We're going to work on level 1 core breath, or kind of the lowest load, most basic version of the core breath. You're going to settle in on your back, comfortably with your knees bent. And then when we work with the breath in this way, we want to think about getting everything in line. So getting your head, your ribs, and your pelvis in line. And it can be really helpful just to prop up your head a little bit. And you can play around with that. Generally speaking, if it feels better to have your head propped a little bit, I would do that. I would recommend that. You're gonna let your arms settle in a comfortable position, and then we'll roll through a couple of pelvic tilts. So you're gonna flatten your back and arch your back. And as we're pelvic tilting, I want you to be thinking about breathing, but not in a really strict or structured way. Just make sure that you are breathing. And as we move, think about your belly, your lower belly, the space between your belly button and your pubic bone, kind of falling away from your pants. You're not pulling it back, you're not sucking it in, you're just letting gravity allow your belly to fall away from your pants. And then we're going to find a neutral pelvis. We're going to start there. You're going to tip your pelvis maybe a little bit forward. Think about your hip bones and your pubic bone, your ASIS and your pubis being level, parallel to the ground. And then also think about the bottom edge of your rib cage and your sternum being parallel to the ground and the bottom edge of your rib cage being in line with the top of your pelvis. I call this stacking your tubes. So we want to get our throat, our digestive organs, and our pelvic floor kind of all in line. Once you have that set up, you're just going to start to breathe. And we're going to think about inhaling through your nose and exhaling through your lips. As you inhale through your nose, your ribs are going to expand. Your belly is going to expand. And we're going to let the pelvic floor relax and see if we can't sense the pelvic floor also expanding on the inhale. And then as you exhale through your lips, we're going to feel the rib cage come together and the belly draw down and away from your pants. And same thing, so keep breathing. Inhaling, everything expanding. Exhaling, drawing together and in. And we can start to think about on the exhale, kind of gathering up the pelvic floor as you exhale. So kind of pulling up front, middle, and back of the pelvic floor, all drawing up and in as you exhale. So we inhale, everything expands. Exhale, everything draws together up and in. And there's lots of different analogies for what the pelvic floor might be doing. The most basic of which is like you think about not peeing or stopping peeing, but that kind of focuses just on the front of the pelvic floor. You might also think about, this one I think is a little funny, like drinking a milkshake up through your vagina. Actually, it's maybe a little bit of an odd analogy, but again, that drawing up and in. I like to think about pulling up socks because your urethra, your vagina, and your anus, your rectum are all tubes, kind of like a tube sock. And so as you exhale, you might pull up your socks, draw everything up and in. And then as you inhale, everything again expands. So it's just a very basic, super relaxed core breath. We're trying to time the expansion of our rib cage, our belly, and our pelvic floor with our inhale, and the contraction or drawing together and in of our rib cage, our abdomen, and our pelvic floor with the exhale. Just spending a couple of minutes practicing that.